Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's learn about a certified coding specialist, which is CCS certification from AHIMA. So we are going to see a brief introduction about CCS certification and the eligibility criteria, exam cost, exam format and duration, as well passing score and recommended study materials. And at last we will see the exam syllabus as well. So let's begin. So Certified Coding Specialist certification is offered by AHIMA, American Health Information Management Association, and this CCS is designed for an individual proficient in classifying medical data from patient records. So CCS professionals demonstrate their expertise in coding accuracy and data quality and mastery of coding system used in healthcare. And who should pursue this CCS certification? So the CCS certification is ideal for the professional who are already have experience coding in inpatient and outpatient records. If not, those who hold CCA certification. CCA is Certified Coding Associate. It's an entry level certification offered by AHIMA. Okay, but that will not be a complicated one, which is a basic certification. So if you have that certification, at least you will have some idea. Based on that, you can go for a CCS exam. So coding specialists generate coded data used by hospital and healthcare providers to secure a reimbursement from insurance companies or the government programs like Medicare and Medicaid. And this data is also utilized by researchers and public health officials to track the pattern of explore new healthcare interventions. So here what you have to understand is the difference between CPC and CCS. Okay, CPC Certified Professional Coder, which is offered by AAPC, and here CCS is offered by AHIMA. So CPC is for profi coding. Okay, it is about completely outpatient coding. We don't learn anything regarding inpatient in CPC exam. Okay, we completely physician coding. When it comes to CCS, here we will learn both outpatient setting and inpatient setting, both for physician coding and hospital coding. Okay, so that is why CCS is generally people will take after certain experience. Okay, so we will see the other aspects. So coming to eligibility criteria, so the normal criteria is the candidates who wants to sit for CCS exam must have high school diploma. Okay, so high school diploma, this is for USA, and here in India, if you are a graduate, that is fine to go with CCS certification. But few will think you need minimum 2 years experience. But if you see, they are officially stated that it is recommended and not required to have at least one of the following. Okay, they are recommending it because if you have any one of this eligibility, then it will help you to pass CPC exam in the first attempt itself. Okay, so what are those? Complete course in all the following topics, including anatomy, physiology, pathophysiology, pharmacology, medical terminology, reimbursement methodologies, and intermediate advanced ICD diagnostic coding and procedural coding and medical services, CPT, and HCPCS, plus 1 year of coding experience directly applying codes. Okay, so if you are the one who have studied all of this and you also have 1 year hands-on experience, then it is easy for you to take the CCS exam. Okay, and same way, if you have 2 years of coding experience, maybe you worked in a surgery or in any of the inpatient setting, it will be easy for you to pass the CCS exam. And if you have not done course, or if you have no certification, you have a CCA credential. Okay, Certified Coding Associate. So you already have started learning what is required for CCS exam. So then it will be easy for you. And same way, hold a coding credential from another certifying organization plus 1 year of coding experience directly applying course. So here you have a CPC certification and you also have 1 year of coding experience. So for you it will be even easier to sit in CCS exam and get pass. And hold CCSP. Okay, CCSP is again Certified Coding Specialist, which is for physician, and registered, no, RIT, RIA, all are credential, or you, if you have any of these credential, it will only help you to pass. Coming to CCS exam cost, so this exam cost will be $299 for AHIMA members and $399 for non-members. That means you have to purchase a membership by paying $100, and after that you will be having $299 for examination. Okay, so totally $399, both including membership plus exam, it will cost you $399. But if you are already an AHIMA member and you have already have done any other certification, okay, now you want to take CCS, means since you have a membership, you will be giving $299 as a exam fee. And next, coming to retake policy, what if you did not pass in the first attempt? Here we don't like in the CPC exam we can directly purchase 2 attempt voucher, okay, but here in CCS we cannot purchase directly 2 attempt. We will have 1 attempt for this $299. Okay, so if we are unable to pass, then again you can see here, to retake an exam, the candidate need to submit a new application along with the relevant exam fee. Okay, same exam fee will continue. Maybe you will have the say for example you have taken $399. In this year you paid membership as well, you purchased exam voucher by paying $299, and the same here you got fail. Okay, so anyway you will have the membership, again you may have to pay $299 to sit for one more attempt, okay, to retake the exam. So here they are saying candidates who have attempted but not successfully passed the CCS exam are required to wait at least 30 days. So you need to wait at least 30 days after your result. Once your result is out, you need to wait for 30 days. And then you can see test retake fees are the same as the cost of exam. Okay, so if you are, even if you are retaking, there will be no changes in the exam fees. You have to pay $299 as an exam fee. So this is regarding CCS exam pricing. Exam format and duration. So exam consists of total 107 questions. Out of these, 97 are scored question, and that will contribute to your final score. Okay, so out of 107, only 97 questions are eligible for scoring, and remaining 10 questions are like that is not regarding any exam, it is just for data purpose only. So you can see, and 10 are pretest items. The pretest items are included for data collection purpose only and do not impact your score, and they are randomly distributed throughout the exam along with the scored question. So regardless of whether you answer a pretest question correctly or incorrectly, it will not count towards your final score. So you remember, you are only writing for 97 question, not for 107. That remaining 10, as I said, it is for data purpose only. Whether you choose wrong, right, it doesn't matter, and they are not taking any score from those 10 questions. Okay, and you can see the 10 question distributed in all the sections. And how much time you will get to write CCS? Candidates have 4 hours to complete the exam. So this is again 4-hour duration. Within 4 hours you need to complete those 97 questions. So coming to passing score, in the CCS exam the passing score is 300. You need to score 300 and above, then only you will be considered as passed. Okay, and exam testing location. So exam is given in a computer based format. Again you will go to testing center and you will take an in-person test in the testing center. Okay, you cannot take CCS exam from your home. You will schedule your exam and you will go to testing center and you will write exam from there, and which is computer based. Okay, not a booklet form, it is also online based, computer based. You will go to testing center and from there you will take exam online. So recommended study material for CCS exam are If you are purchasing book, you should purchase a current year book for ICD 10 CM, ICD 10 PCS and CPT book. These are the three major books we required for CCS exam. And if you see, only books included in the list below will be allowed in the testing center. And please pay close attention to ISBN numbers. Test center employees will verify the ISBN number, title and publisher against those included in the list. So as we know that like either you can rent a book, but make sure whatever the list they have provided here, you should purchase or rent from only these publishers. Okay, these are the approved publishers. If you are taking ICD 10 CM book, it should be from AHIMA or Optum 360, AAPC, TMIC. Okay, all of this, the publisher you can see here. And same way ICD 10 PCS also, either it should be from AHIMA or AMA, AAPC, Optum 360. Okay, so from these publisher you can either rent or either you can purchase the book. And same way CPT code book, which is a solo publisher, which is AMA. Okay, so make sure you use the current year books. Okay, for CCS, CPC it is fine, but CCS you have to be with the current year code books only. And so next, coming to exam syllabus. So you can see these competencies of CCS fall into 5 different domains. Each domain account for a specific percentage of the total question on the certification exam. So CCS, which is very important, this criteria is important because they will score from all the domain. Okay, you need to be thorough with all the domain and you cannot skip any one domain, and you should have, their motto is you should have knowledge in all the areas. Okay, so that is how they will score the final exam marks. So as I said, the 5 different domain, this is exam syllabus. So the domain 1, which is coding knowledge and skills, which covers 39 to 41% of the syllabus. And here if you can see, assigning the code and the procedure codes based on provided documentation in health records, identify principal first listed diagnosis and guidelines, apply coding convention, guidelines and regulatory guidance, and attach CPT HCPCS modifier to outpatient procedures, determine sequencing diagnosis, apply present on admission, that is POA indicators, POA guidelines we have, and demonstrate knowledge coding in NCCI and medical necessity, DRG and APC, MCC and comorbid conditions. Okay, so all of this will be included in the domain 1, which is coding knowledge and skill. And next, domain 2 is coding documentation, which covers 18 to 22% of the syllabus, and it resolves conflicting documentation in health record, what is admission and the type, laterality, all this comes, and ensure all the required documentation is assigning a specified code is available within the body of the health record, and verify and validate the documentation within the health record. It is also important how we read the documentation. We should know the coding documentation, how it should be. Like if something is missing, we should be able to identify what is missing in the documentation. Okay, so domain 2 is all about coding documentation. Next, coming to domain 3, which is provider queries, which covers 9 to 11%. Identify the elements in the ethical compliant query, determine the provider query is a complaint, and analyze the current documentation to identify the query opportunities. Domain 4, it's a regulatory compliance and it covers 18 to 22%. Ensure the competence and accuracy of health records, understand the payer specific guidelines, identify patient safety indicators and hospital acquired conditions based on provider documentation, ensure HIPAA guideline, and ensure to adherence, to be adhered to AHIMA standard ethical coding, and ensure the compliance with a uniform hospital discharge data set, that is UHDDS. And coming to domain 5, which is informational technologies. So here various types of, it's like more into software and the medical records. So here various types of EHR, electronic health records, demonstrate the basic understanding in encoding and group software, and exhibit understanding of computer assisted coding software and its impact on coding, ensure the compliance with high-tech guidelines. Okay, so these things we have for syllabus. As a syllabus we have for CCS, and if you see, scenarios include inpatient 33%, outpatient 33%, emergency department 33%. Okay, so scenarios, it look like this in the percentage wise. So they'll combine both inpatient and outpatient as well emergency department services. So if you are wondering, like as I said, CPC is for profi coding, physician coding, or you can consider outpatient coding. And CCS, as I said, both you will learn ICD-10 CM and CPT, and additionally you are going to learn ICD-10 PCS, okay, which is again for procedure coding. So if you are in AAPC coder, like if you are a certified CPC coder, okay, what you have to do is, if you want to learn inpatient and you want to continue with AAPC, then you can just go with the CIC certification. That is one more certification. CIC is from AAPC, and where you will learn all the inpatient criteria. Okay, so you at least you will have the same membership, a single educational board membership you will have, and you will have multiple certification. Okay, so if you have both membership in AAPC and if you have membership in AHIMA, then you may have to pay different membership cost. Okay, so that will be heavy. So if you have already taken the membership from AAPC, try to continue with AAPC, or if you have taken from AHIMA, go with AHIMA. Okay, so this is the information about certified coding specialist certification. And if you want any other certification information, you can comment. And if you want CCA certificate, that as I said, it's an entry level certification for coders, beginners. Okay, so which is only for 2 hours examination. And if you want the detail, please comment, I can share. And yes, that's all. I have covered what is required to start with the CCS, and I hope this video will help you to gain some insights. And if you find it useful or informative, please do subscribe to my channel and please do share with your medical coding friends. So this video I am making because yesterday as I conducted free webinar and many of the students have joined, and most of them were asking the difference between CPC and CCS and CCS syllabus. So I just wanted to make it clear, so quickly I made the video. So yes, thank you all, thank you for watching.